Welcome at the digital information presentation about the birth. Photos used in this presentation come from photography Fijn Huisje and a client of our practice who had a birth photographer present at her labor. Sources for the information are the KNOV, which is the Dutch Midwifery Organization, and the Flevo Hospital. During this presentation, we will discuss the following: the normal birth, location of birth, at home or in the hospital, when to call us, what the partner can do, pain relief, different positions, the birth plan, what to bring with you to the hospital, different scenarios that could happen, and the postpartum period. The birth. A term labor is a labor in the normal time frame. This is between 37 and 42 weeks of pregnancy. You can give birth with the guidance of your own midwife between those 37 and 42 weeks. Before or after this period, you will give birth in the hospital with a medical indication. Labor can start by breaking of the water or with contractions. About 10% of women start with breaking of the water. You might notice that you lose some water. Sometimes you can feel a little pop inside. Once the water is broken, you will continue to lose small bits of water constantly. We will discuss later in this presentation when to call us if this happens. 90% of women, the labor starts with contractions. Usually it will start slowly with cramps that are manageable, and over time you will notice that the cramps increase in duration, strength, and frequency. Overall, there are 5 stages in labor. The first stage is the latent phase. This is the phase in which the contractions start and increase to the point where they are increasingly painful and you have to focus on breathing to manage them. The latent phase lasts until about 4 or 5 centimeters of dilation. Progression of dilation can be slow in this phase, as your body is transitioning and the cervix needs to soften and shorten before opening up. This phase usually takes the longest. It is good to try to look for distraction. Don't focus too much on the contractions or the pain yet in this phase and keep moving. It is also important to pee regularly, as an empty bladder helps progression. The second phase is the active phase. In this phase, the contractions are active and regular every few minutes apart, and you will have to concentrate and focus on breathing to manage them. Try to find a position that is most comfortable. We will discuss possible positions in more detail later. Walking, sitting, leaning on something, or a shower or a bath might be nice. This phase is usually from 4 to 5 centimeters of dilation until 10 centimeters or full dilation. The third phase is the pushing stage. In this phase, your body will start to create a pushing urge. Usually right before this stage, at 9 centimeters of dilation, is the moment of despair. Women experience in that phase that they don't want to do it anymore. It's getting quite hard. However, this is usually a sign that you're almost there, almost ready to push. So we will try to motivate you to hang in there. When you're going to feel the urge to push, you will notice your body taking over. It's a reflex that you cannot stop. You will feel pressure on the bum and your belly starts to push the baby downwards. In this stage, you will stop breathing away the contractions and start to push actively. There are different positions in which you can push. We will discuss them later on. On average, for a first child, it is normal to push for 1.5 to 2 hours. A second baby usually is much faster, a maximum of about half an hour. Stage 4 is the birth. At this moment, the baby will be born. The head of the baby will start to appear. Before the head is born, we try to wait a little moment so that the skin can stretch and you tear less. Listen carefully to the instructions of your midwife at this moment, as she will tell you when to stop pushing for this moment. When the baby is fully born, we will help you to put the baby on your breast. We normally wait for the umbilical cord to stop pulsating, usually about 5 minutes or longer before cutting it. The partner can cut the umbilical cord if he or she wants to. The first hour after birth is the golden hour in which the baby will stay on your chest. The golden hour is good for bonding, breastfeeding, and the health of the baby. Stage 5 is the afterbirth. After giving birth to the baby, you will have to give birth to the placenta. Sometimes the placenta will follow quickly and easily. In case it does not follow by itself or you lose too much blood, we could give you an injection in your leg with some oxytocin that will help the uterus to birth the placenta. We only give this if necessary and will discuss it with you before giving it. When the placenta is born, we will check if it's complete. You can decide what you want to do with it. Take it home or leave it with us. When you are healthy and there are no complications during the pregnancy, you can choose where you want to give birth, at home or in the hospital. If you are healthy, a home birth is as safe as a hospital birth, because here in the Netherlands we are trained as midwives to do home births and keep on checking if all goes well. In case of an emergency, we bring supplies and medication. Some women prefer a home birth because they might feel more relaxed in their own home. This can help to increase the natural pain relief system of the body. You might feel relaxed in your own shower or bathtub, and this could help you to go into your own bubble more. Less people around you also might be helpful. In this relaxed environment, your oxytocin, the hormone that creates contractions, can do its work. You do not need to go in the car with contractions. Sometimes we will have to transfer to the hospital anyways. Usually there is no rush and you can go in your own car. Very rarely we might need the help of an ambulance in case of an emergency. Some women prefer to give birth in the hospital because that is the place where they feel more relaxed. It might be an advantage that there is no mess at home. Although we try to work as clean as we can at home and together with the kraamzorg we clean the mess afterwards. In the hospital it can be an advantage that pain relief is close by. You can also give birth in the hospital, of course, without medical pain relief. However, in case you might need it, it is there to arrange for you. If you choose to give birth in the hospital and there is no medical indication, your own midwife and kraamzorg will be there. You may have to pay a fee depending on your health insurance for this birth. If you want to know what the fee is, you can contact your health insurance. When to call us? When the labor starts, call us on the emergency number. Also, if it's during the day and the assistant is reachable as well, we still ask you to call on the emergency number. For this, you press option 1 when you call us. A normal birth happens between 37 and 42 weeks. If before 37 weeks you think you might have contractions or the water breaks, call us right away. 10% of women start with breaking of the membranes. In case the water is green, brown or yellowish, you need to call us right away, also in the night, because this might mean the baby has pooped in the amniotic fluid and this is a reason to go to the hospital. In case the water breaks at night and the water is clear, so whitish or pinkish or just normal water color, we recommend to try to go back to sleep if you do not have any contractions. It can take some time before the contractions start and you will need the rest you can get. If this is the case, call us in the morning. If during the day the water breaks, call us right away, regardless of the color. If it's hard to see the color, put a maternity pad in your underwear that you find in the kraampakket and try to catch some water to determine what the color is. If the labor starts with contractions, usually it will start calm, with contractions or cramps that increase over time. When you give birth for the first time, we want you to call us when you have contractions that are 2 to 3 minutes apart, that last for about 1 minute, and that you need to focus on breathing to manage them. When you have given birth before a labor, it can be a bit faster, so we want you to call a bit sooner, when the contractions are 4 to 5 minutes apart, lasting about 1 minute. In the last stage of the pregnancy and during labor, you can experience some blood loss. This is normal as the cervix is softening and opening up, and therefore it can bleed a little. If you have clear red blood loss more than a €2 coin, call us anyway. Of course, overall, if you are worried or you want to discuss something, you can always call us, whenever. The partner. In this section, we discuss the role of the partner, assuming that there is a partner. Of course, sometimes women do not have a partner, so the role can be there for another person assisting you, such as a mother or father, friend or sibling. For partners who like soccer, we will start with a little quote we once heard. A soccer player is the one who does the job, dribbling with the ball and hopefully scoring a goal. He is the one that is visibly working hard. However, next to the player is the coach, who will cheer him on and support him to reach his best potential. Without a good coach, a team does not play well. So you as a partner are the coach. Your support and assistance will help your wife to get through labor better. So do not feel left out, you are a very important part of this team. In the book Aanpakken voor aanstaande vaders, which is a Dutch book written by David Boorman, he discusses 4 roles: the coach, the supporter, the carer, and the advocate. As a coach, you are an expert. However, maybe this is your first time being present at a birth. No panic. Try to gain as much knowledge about births that you can. How in general will a birth go, which phases to expect, etc. What you could do during these phases to help your wife. In this way, you become somewhat of an expert so that you can coach her. As a supporter, you are the one who will keep up the courage and faith, even if it goes different than expected. Especially if it goes different than expected, try to encourage your partner that she can do it and that it will be okay. As a carer, you can take care of your partner. You will feel what she needs and when she needs something. Think about bringing her something to drink, a cool washcloth for her face, or reminding her to pee regularly. Note, a carer can only take good care of someone else when he takes care of himself as well. So do not forget to eat, drink, visit the toilet, etc. yourself, and maybe sometimes try to take a little nap. The advocate. As an advocate, you are there to stick up for your partner. In case something happens that is different than discussed beforehand, the advocate will be there to talk about it. You can help to advocate for the birth plan that you might have made together. Pain relief. During labor, there are different options to help you get through the contractions. For example, different positions could be helpful. Also, warmth can be a good pain relief. Thinking about spending hours in the shower breathing through the contractions, or using a warm water bottle for the belly or the back. Massage can also be nice pain relief. Your partner can do this, or we can. Usually, pressure or massage in the lower back is helpful. Lastly, the TENS machine can be provided, a good non-medical form of pain relief. The TENS is sometimes covered by the health insurance, so make sure to check this. If you don't get this covered by the insurance, we can bring a TENS machine with us when we visit you. However, if you're going to give birth in the hospital, the TENS machine is not there, so then you should bring it on your own. The TENS will give you soft power surges in the lower back. These power surges distract your brain, as the brain cannot focus on 2 stimuli at the same time, so it will distract you from the pain of the contractions, making the contractions more bearable. In case you want some medical form of pain relief, we can arrange this for you. There are 2 options for this in the Flevo Hospital: the epidural and the remifentanil pump. It is good to know that when you choose to use medical pain relief, we will have to refer you to the hospital for this. It means that the hospital staff will take over the care from us and we have to go. Of course, we will make sure that this transition is as smooth as possible. The epidural. When the epidural is placed right, you will not feel the contractions anymore. Some women do still feel something, some pressure. With an epidural, you will have to stay on the bed as you cannot stand on your legs anymore. With a catheter, we will empty the bladder since you cannot go to the toilet to pee. You will get an IV to give you some fluids so that your blood pressure will be stable. The epidural can be given from the early stage of the birth up until 6 to 7 centimeters in general. The anesthesiologist is the one who will put it in. It takes some time to arrange this, as it depends on how fast the anesthesiologist is available. Therefore, in the last few centimeters, we usually do not give the epidural, as by the time it is arranged, you are usually ready to push. A side effect of the epidural can be a fever. Since we then do not know for sure if the fever is caused by the epidural or by an infection sometimes, you will be treated as if prone for an infection. Antibiotics could be given. Remifentanil. The remifentanil is a morphine-like medicine that will make the peak of the contraction less high. So you will still feel the contractions, but they will be less intense. Also, you will get a little high and sleepy from the medication, so in between contractions you can rest better. Since it makes you so sleepy, you have to stay on the bed. Also, it could cause your breathing to slow down, therefore we will monitor your breathing and the heartbeat of the baby extra. The medication also goes to the baby through the placenta, so when you start pushing, we will take the medication away so that it is out of your system once the baby is being born, as we don't want the baby to be sleepy then. Remifentanil is usually given in the later stages of the birth, after 6 centimeters, as it works best for 4 to 5 hours. After that, your body will get used to it and the effectiveness will be less. Positions. The Dutch Organization for Midwifery, the KNOV, has researched the effect of different positions during birth. When you change positions often, women experience less intense pain and it can decrease the total length of the labor. For example, when standing, women describe less pain and a shorter duration of labor compared to women who are lying down. Also, choosing your own position in which you prefer to give birth increases your feeling of control and autonomy. In this dia, you see some possible options for positions. Vertical or upright positions are good during the pushing stage because in that way the gravity will help the baby to move deeper into the pelvis. The birth plan. The birth plan is an important part of preparing for the birth. Quite often women decide to not make a birth plan as a birth is not plannable. This is true, of course, and it's good to go with the flow and see what happens and anticipate on that at that moment. However, we do recommend to think beforehand about things that can help you during the birth. The word birth plan is not the best word, because a birth plan is not a wish list or a description of how the birth should go, but it's a way to think about if the birth goes different than expected, what you would want then, or what is important for you, especially then. For example, if you ideally see a birth at home without pain relief, but for whatever reason during the labor there is a reason to transfer to the hospital, how would that be for you? In case this would happen, what do we need to know so that even if the birth goes different than expected, we can help you and support you so that you can have a positive birth experience. So think about different scenarios and what you would prefer in these cases. On our website we have some formats for birth plans that you could fill in. Scenarios. In this section we would like to discuss some possible scenarios with you that could happen during birth. We think that the more knowledge you have about the birth and what could possibly happen will help to prevent stress if something happens that you might not have expected. We do not want to scare you with these scenarios, but these are things that happen quite often and so are good to prepare for or to know about beforehand. Serotinity. This means being overdue or past the due date. A normal stage to give birth is from 37 to 42 weeks. After 42 weeks, the general advice is to induce the birth, as from then on the risks for the baby and for yourself increase. At 41 weeks, we will do a quick checkup in the hospital, where they make a CTG, a heart movie of the baby's heartbeat, and the amount of amniotic fluid will be checked. If these checks are good, then it is safe to wait for normal labor a week longer, until 42 weeks. However, there are 3 options from 41 weeks onwards. One option would be to wait until 42 weeks to see if labor starts by itself. The other option would be to try membrane sweeping, and the last option would be to plan an induction in the hospital. In the week between 41 and 42 weeks, we will try membrane sweeping if you want. Membrane sweeping is a massage of the cervix in which we hope that this helps the body to start the process of labor. Sometimes we might need to repeat this once or twice before it is effective. It is not always effective in that it starts the labor, but for some women it can prevent a medical induction. As scientific research in which membrane sweeping is studied, we see that 1 in 6 to 8 women will go into labor after membrane sweeping. A membrane sweep is done by doing an internal examination with 2 fingers. We will make a rotating movement in the cervix. This can help the membranes to soften and free prostaglandins. These are hormones that can start the process of labor. When your body is getting ready to deliver, membrane sweeping can sometimes give the last push to actually get into active labor. Cons of membrane sweeping could be that it could be painful for some women and it could sometimes cause an increase in irregular Braxton Hicks or practice contractions without actually starting active labor. It could cause a little bit of bleeding, but this is not harmful. When you are 41 weeks, you can also choose to not want to wait longer, but to induce the labor. You are free to choose what you prefer, to wait, do membrane sweeping, or induce the labor after 41 weeks. Pros of waiting. We see that women who wait get less medical interventions needed and more freedom of choice. About 73 to 77% of women who wait get into labor spontaneously. On average, most women give birth at 41 weeks and 2 days. Cons of waiting. Individually, we will make a plan as to how often we will do extra checks in the week between 41 and 42 weeks. So far, scientific studies have not found what would be the ideal number of checks to prevent risks. Pros of induction: decreases the already small risk of death of the baby around the birth. This effect seems to be more in the group of women who give birth for the first time. However, the risk for this overall is very, very small already. Cons of induction: 11% of women who are induced, the body is not ready to give birth yet and the induction will fail, resulting in a C-section. With an induction of a first baby, this happens in about 18% of women. The birth will be medical in the hospital with the staff of the hospital. More medical interventions will be necessary, such as an IV, continuous CTG monitoring, more internal examinations. There are not a lot of studies done on long-term effects of an induction on the health of the baby, psychological health of the mother, or breastfeeding. Pain could be experienced as more intense, so more often women opt for pain relief with an induction. An alternative to a medical induction could be breaking of the water. This can be done only if the cervix is ripe enough, so about 2 to 3 centimeters of dilation should already be there and the cervix should be effaced. It is good to think about what if you are overdue. Do you understand all the options? Or do you have questions about them? What would you prefer? Around 39 weeks, we will discuss with you those options in more detail and also give you an overview, a folder about those options. Long-term ruptured membranes. About 10% of all labors start with rupturing of the membranes. In more than 60% of women, the contractions will start within 24 hours after this happening. However, in some women it takes more than 24 hours before contractions start once the membranes have ruptured. If the membranes are ruptured for more than 24 hours, we call this prolonged ruptured membranes. Prolonged ruptured membranes is a medical indication, so it means that 24 hours after rupturing of the membranes, we will refer you to the hospital if you are not in labor yet. Once the water is broken, the risk of an infection in the uterus increases, as there is an open connection for bacteria to get to the inside of the womb. When the water is broken more than 24 hours, we will refer you to the hospital for a checkup. Some tests will be done there, such as a CTG and a swab to check for certain bacteria. If these checks are good, you can go home and wait for another 48 hours to see if the contractions will start. 95% of all women will have spontaneous contractions within 72 hours after the breaking of the water. In 5% after these 72 hours, there are still no contractions. At that point, the medical advice is to start inducing the contractions, as the risk of infection increases the longer we wait. To possibly decrease risk of infection once the water breaks and there are no contractions yet, we have some advices. Do not go in the bathtub, do not use any tampons or have sexual intercourse. We advise to rectally measure your temperature every 8 hours and call us if you have a fever. When the baby is born after the water has been broken for more than 24 hours, this means that you will stay 12 to 24 hours in the hospital after birth for observation to keep an eye on the baby and check for possible signs of infection. Insufficient progress of dilation. There is a big variation in how long a normal labor lasts. In active phase, so from 4 to 5 centimeters onwards, we see that on average a first baby's labor takes about twice as long as any consecutive labor. On average, the labor of a first baby takes 10 to 14 hours from the moment of contractions are regular, about 3 minutes apart. For a second or third baby, etc., it takes 8 to 10 hours on average from this point onwards. When we see a stagnation in progress of the labor, this could be a reason to refer you to the hospital. We will try first things such as changing position, emptying your bladder, etc. to see if we can get the labor to progress well. If this does not help sufficiently, we will refer you to the hospital for additional stimulation of the progression by starting an IV with oxytocin. This hormone will help the contractions to get stronger or more effective, and when we are at home, this would mean we have to transfer to the hospital. Usually not by ambulance, but just in your own car. Insufficient progress of the pushing stage. You have reached 10 centimeters and can start pushing. Women experience this as a different, usually nicer sensation than dilation contractions, as you now can actively use the contractions. On average, with the first baby, it's normal to push 1.5 to 2 hours. With the second or third or fourth, etc. baby, on average the pushing stage lasts maximum of 30 minutes to 1 hour or shorter. In case the pushing stage lasts long or we do not see sufficient progression, we will check what could cause a delay. For example, we might feel if the head of the baby is positioned in the right way in the pelvis. We will try to stimulate normal pushing stage by changing positions, for example using the birth stool or emptying the bladder. If we see that this does not help sufficiently, we might have to transfer to the hospital. In the hospital, they will usually start an IV with oxytocin to create more effective contractions. Sometimes a vacuum extraction could be necessary. Cesarean section. The gynecologist will advise to do a C-section if giving birth vaginally is not possible or will create high risks for you or your baby. Possible reasons for this could be the baby lying in a suboptimal position, for example in breech, or a big baby in combination with a small pelvis, a placenta in front of the cervix, or women who have had a C-section before. A C-section is not an easy way out and can cause complications. Also, recovery is harder and longer than with a vaginal birth. Therefore, a C-section is only done if there is an indication for it. Sometimes we know beforehand that a C-section is the best option. We call this a primary or planned C-section. Sometimes during labor a cause for a C-section arises. We call this a secondary C-section. For example, insufficient progression of dilation or pushing could be a cause, or concerns about the condition of mother or baby. For example, if we see a problem in the heartbeat of the baby on the CTG, or we see that the baby is in distress with a blood check of the baby. Too much blood loss. It is normal that after you have given birth, you will lose some blood, as there is a wound in the uterus when the placenta comes out. In case you lose more than 1 liter of blood, we call this too much. We will then have to make sure that the blood loss will stop, as it could be dangerous for the mother to lose some more blood. Sometimes we will need to give you medication to stop the blood loss. Usually this is effective. However, sometimes a surgery might be necessary to stop the bleeding. In case you have lost a significant amount of blood after birth, it is important to rest a lot in the weeks after the birth and eat healthy and iron-rich foods to recover well. We have discussed some of the more common complications or scenarios that could happen with the birth. Of course, most of the times these complications do not happen and the birth goes well. So don't let these complications scare you too much. See it as a way to prepare for possible scenarios. Postpartum. In the first week after the birth, we will visit you and the baby a few times at home. We will check the health of mom and the baby during these home visits. We will discuss the feeding, breastfeeding or bottle feeding, and we will of course discuss the birth experience with you. You can ask any questions you might have. Usually 1 week after the birth will be our last checkup over the phone. However, if necessary, we can always do more checks. In the weeks after the birth, you can call us if you have any questions. In the weeks after the birth, it is very normal that you might experience the baby blues. You could notice that you are more emotional than before, or you might experience mood swings. Hormone changes, tiredness, processing the birth experience, etc. can all influence this. Also, you might have envisioned the postpartum period differently. The responsibility of this newborn baby is a feeling most first-time parents have to get used to. All of these factors contribute to how you feel. Around 3 to 4 days after birth, we see that the baby blues are most often there. It's good to feel all the feelings. Let it be there. It is okay to cry and sometimes not even know why. Bottling it up does not help. Throw it out. After a few days, most women notice that they feel less emotional and start to feel better again. We advise to prioritize rest in the postpartum period, as this will help you feel better. So, do not plan too much visits with friends or family, but make sure to rest. Some women do not notice that the baby blues decrease, but will feel not themselves for longer than a few days. You might feel depressed, languid, no appetite, you might not sleep well, or you might not experience joy or enjoy small moments. Sometimes you might even wish that the baby is not there. If you notice any of these feelings, feel free to talk to us about it, to the kraamzorg or to your partner. You might feel shame about these feelings, but know that it is okay to talk about it, and we want to help you where we can. Some women can experience postpartum depression. Around 10 to 15% of women experience this. Some women are more prone for developing a postpartum depression. For example, if you have experienced depressing feelings during the pregnancy, or if depression is common in your family, or if you have experienced it before. Please feel free to talk to us about it, also if you're experiencing anxiety about this. We hope this presentation helps you to prepare for the birth and the period after the birth. Please feel free to discuss any questions you might have about the presentation with us the next checkup. We hope you will have a positive birth experience regardless of how the birth goes, and wish for a good start for you on the journey of being parents, being a family.